Hi everyone, I'm Kristy from Robbins Rehabilitation East. I just wanted to talk to you a little bit today about pain and how we can make some changes in our thought process that could potentially influence your pain, and also just to give an understanding of some less commonly known facts about pain and how our body perceives it. So first, I use this book. It's called the Protectometer. It's kind of a funny name, but it's from Australia. And they use a little bit of a different terminology than we typically would, but it's really helpful to get to know yourself and other things that might be influencing how you feel on a day-to-day basis. What we know about pain is that it's not just about the quality of your tissues and whether they're damaged or not, but instead it relies on external forces too, your environment, people in your life, places that you are. So some of the researchers that are out there developed this book to help with that. One of the exercises that we might go through when you come to therapy is reassessing some of the things that happen on a day-to-day basis in your life. And there's a whole chart that we use like this. It's color-coded. And what we have, this is the actual Protectometer. We have things called DIMS and SIMS. So DIMS are dangers in me, SIMS are safeties in me. What that means is basically we want to know all the things that might be your body might be sensing as a danger, and things in your life that might be good or cause you happiness. We know that when we don't have a balance of this in our life, we are more likely to experience pain. So first, where we start, we've got little stickies at the back of the book here. You can use just a regular Post-it note at home if you wanted to try this, and just start making a list of things that you think might be good or bad. And we put it into different categories. So some of the categories you'll find, these are on both sides. Things you hear, see, smell, taste, and touch that might be a danger to you. So say you go to a dentist and you hate the smell of the dentist, that's gonna raise your body's threat level and it might be a little bit more protective. Things you hear, that could be anything people say to you, that might be detrimental or negative. Things that you say. One of the things we commonly hear is that you have osteoarthritis and you might not feel like you're ever going to get better, or how can you fix that? So all of those things influence how our body perceives pain, and actually I should say input to our body. Places you go. So places you go can influence it. Again, if you go to a doctor and you're terrified of the doctor, your body's going to be on high guard, and you might be a little more apt to experience increased pain. Things happening in your body. So you know that there might be degenerative changes. Maybe there's some arthritis, all of which are very, very normal, but it might be creating a little bit of fear. Things you do. That could be sitting all day. It could be smoking. Anything negative to your body that can influence how you feel. Things you think and believe. So again, that goes back to even when we're kids and learning things. If we believe that somebody hurts their back and you're gonna have pain for the rest of their life, your life, it's more likely that you're gonna kind of follow down that path. So we try to change the way of thinking a little bit. And then last, people in your life. This one's a different one because you can have people that are on both sides. You can have places that are on both sides, but most commonly we find spouses can go on the good side. They can also go on the bad side. Family, it could be neighbors that you don't like, anything that causes a little bit of extra stress. Opposite to that, we have the safeties. There's things that make us feel good. All the same questions. So again, it's things you do, things you think or believe, people in your life, things happening in your body. That could be something like you see healing happening, or you feel a little bit stronger. Places you go. Things you say, and things you hear, see, smell, taste, and touch. So all of this can influence how you feel. What we find is people can fill out this danger side quite easily, and often have a stack of sticky notes. But on the safety side, on the good side, there's not as much. We challenge you to take a look at that and think really deeply about it, and see if there's any changes that you could make, because when you start to get a better balance of the dangers and the safeties, your body is going to be a little bit more receptive to any type of treatment, therapy, and feel a little bit better, and ultimately help decreasing your pain. So if you're interested in this book, you can actually find it on Amazon. It is very helpful. It talks a lot about pain, but it's a fun little exercise to do to really evaluate some of the things that might be influencing your pain. So thank you very much.